Hi, I'm Patrick McConville. I'm the program director for the Department of Anesthesiology at UT Medical Center. I think the most unique things about our training program compared to other residency programs around the country is that we have a sort of a hybrid model of a private practice and private hospital group within an academic anesthesiology department. And so that creates some opportunities for our residents I think are unique compared to some of our peers. We have uh, a lot of private surgeons who operate very quickly, and so I think for our residents they can accomplish quite a bit more a number of cases in a given day. But also we have several surgical residencies, and so we have the advantages of an academic institution as well. So research opportunities and working with other residents creates for a great kind of hybrid environment. Additionally, we are a median-sized academic institution as far as the number of surgical cases we do for anesthesiology, but we have a smaller than average anesthesia residency program, and so that creates greater flexibility in our program than most residents have in other anesthesia departments. We have a large pool of CRNAs and SRNAs so that we can better tailor our residents' experience towards uh, uh, cases that most benefit them. We can target their needs much more easily. We have approximately 60 surgical sites in a given day, and we have a number of residents in ORs that may be about 6 to 8 per day, so we can pick those, which is a great benefit. Also, the efficiency of the operating room allows for us to be able to accomplish our case totals and experience much more efficiently, and so our residents are able to do many of the perioperative medicine experience that they'll be doing in their career. We have more than the minimum time for ICU experience, for regional anesthesia, for chronic pain, for acute pain, and for assisting with other residents and learning opportunities where they're not required as a high number of our providers. And so it allows us to really experience that perioperative experience in more detail than a lot of places that I've seen. Additionally, a unique aspect is that we have with the private practice within the institution, that creates for a much more long-running faculty presence. Most of our faculty members, we've only had a few leave in the 25 years that our chairman's been here, and so that creates for a very strong buy-in to the program and a desire for lifelong connection to it. And so that, combined with the fact that our residents don't do a lot of subspecialty call and our faculty don't either, creates for an experience where residents and faculty are working together throughout their residency, not just on subspecialty rotations. That's unique. That allows for more coaching of our residents and more continued accountability for one another, creating, I think, what I would describe as a family-type atmosphere that's been long-serving in this institution and mirrors what other residency programs in this institution have done. Additionally, I think that the fact that our residents are within one building, one large academic center for 46 of their 48 months, it creates the residents get to see one another repeatedly, and so that also fosters that family-type atmosphere. Another unique aspect is due to the fact that we have several private practice groups in this institution, we had partnered with the University of Tennessee School of Business to create some opportunities for our anesthesiologists as well as physicians around the institution on such things as negotiation, finances, lean processes, and it creates, I think, a really great opportunity for our residents to participate in those. And so we've initiated that in a seminar series because a lot of our graduates are going to go into practices. Yes, many of them will go into academic institutions that are sort of hierarchical, but a lot of them will go into private practices that have these requirements when they go into practice that a lot of programs don't bring to them. And so we've partnered with the highly ranked School of Business to start the Physician's Executive MBA for anesthesiology that allows a fellowship for those that are interested, and that's been a very great success. Our goal for our residents at the end of training are to be board certified on their first attempt, to be able to go into any fellowship of their choice, or go into practice, whether it be in academic anesthesiology or any private practice, and really be ready from day one to hit the ground running. Our graduates have really experienced a lot of a multitude of practice on a regular basis. They do a multitude of cases in any given day, and are experiencing a busy anesthesiology practice, and so they're very comfortable going into practice, so that's one of our goals. Our clinical and research expertise here has focused on our basic science research involves sleep and neurocognitive function, and that has been a very successful program that has put us in the top 30% of NIH funding for several years. Our main focus currently is clinical research that involves the opiate epidemic in this part of the country, and so a lot of our processes have involved improvement in pain outcomes and perioperative outcomes and reducing the consumption of narcotics for our patients. And additionally, we have a very busy neurocritical care unit, and so a lot of our research clinically has focused on the care of stroke patients. I'm not a native of Knoxville, but when I moved here, I didn't know much about it. I will say that it has some real advantages, that it's a large enough city to have some of the big city amenities, but without some of the, not too large, that doesn't have some of the big city problems that other areas have. Has a very low cost of living, is very friendly and clean and safe. But my favorite part, honestly, is the number of outdoor recreational activities that draws a lot of our residents. There are multiple lakes nearby, hiking trails, certainly the Smoky Mountains, but multiple state parks and trails and bike trails. And so it's been a fantastic place to experience that outdoor activity, especially in the setting of a hospital practice that is entirely indoors. And in one hospital, it's a great outlet for our residents and our faculty to be able to really take advantage of that. We have a long-standing, as I mentioned, number of surgeons and faculty members that are here for their entire career. We have a real focus on teamwork. The entire institution has gone through lean training, and so that creates a very collegial atmosphere. Our anesthesiology department is long respected as an institution, and so we do have a very collegial work environment with our surgical and medicine colleagues, which creates for a great atmosphere and a respectful atmosphere for our residents, and our residents very much appreciate that and have told me that over the years.